If you or someone you know has just been prescribed Sotalol, then you are in exactly the right place. We're going to break down everything you need to know to take this medication safely and effectively, based on key medical guidance.
So what exactly is Sotalol? Well, you can think of it as a pretty specialized tool for your heart. Doctors prescribe it for serious heart rhythm problems, arrhythmias. Basically, its whole job is to work on the heart's electrical signals to get that rhythm back into a safe, steady pattern.
Now you might be thinking, why a whole guide for just one medication? And that's a fair question. It's because Sotalol is really, really good at what it does. It's powerful. And because of that, you have to follow the instructions to the letter. It's all about making sure it helps you without causing any other problems.
So here's our game plan. We're going to walk through this in 4 key parts. First, we'll cover how you get started with the treatment. Then we'll talk about your daily routine at home. After that, we'll dive into the really important safety warnings, and we'll finish up with the single most important rule you have to remember.
Okay, let's jump right into part 1, starting your treatment. The first thing to know is that your journey with Sotalol is a bit different from most other meds. It almost always begins in a hospital or a place where you can be closely monitored.
This initial phase is all about safety. You can expect to be in the hospital for at least 3 days. And while you're there, the medical team is going to keep a very close eye on you. They'll be using an ECG to watch your heart's rhythm, and they'll also check up on your kidney function. This isn't just routine. It's a critical process to find the exact perfect dose that is safest for your body before you head home.
Okay, so once the doctors have you all set with the right dose and you're back home, the focus completely shifts. Now it's time for Section 2, building a rock-solid daily routine. This is where you really take the driver's seat.
When it comes to Sotalol, the name of the game is consistency. I mean it. You've got to take your dose at the exact same time every single day. Put an alarm on your phone, whatever it takes. And here's another big one. However you take it the first time, with food or on an empty stomach, you have to stick to that every single time. Why? Because food can change how your body absorbs the medicine. And of course, never, ever change this routine without talking to your doctor first.
Now let's talk about something that happens to all of us. What do you do if you miss a dose? The rule here is super simple. If you realize you missed a dose and it's almost time for your next one anyway, just skip the one you missed. The one thing you must never, ever do is double up to try and catch up. That is a huge no-no and can be incredibly dangerous.
And just a quick word on storage. To keep the medicine effective, it's pretty simple. Keep it at room temperature and in a dry place. You know that medicine cabinet in your bathroom with all the steam from the shower? Yeah, that's actually not a great spot. Keep it in the bottle it came in, shut tight. And of course, keep it somewhere that kids and pets can't get to.
All right, let's move on to Section 3, and I really need you to lean in and listen here. This is, without a doubt, the most important section of this whole guide. We're talking about the critical safety warnings. This is stuff you absolutely have to know to stay safe.
I want you to really focus because this is serious. If you experience any of the symptoms we are about to discuss, that is an emergency. That means you don't wait, you call for help, or get to an emergency room immediately. It is so vital to know the difference between a real emergency and a more common side effect. So on the severe emergency side, we're talking about things like fainting, being so dizzy you feel like you'll pass out, chest pain, or suddenly struggling to breathe. These are major red flags. Then there's the more common stuff, like feeling tired or having a headache. You should definitely tell your doctor about those, but they're not typically a race to the hospital situation.
Okay, here's a special alert that's incredibly important. If you get sick, like a stomach bug with a lot of vomiting or diarrhea, you need to call your doctor right away. And here's why. Losing all those fluids can really throw your body's electrolytes out of whack, and that imbalance can make Sotalol much more dangerous. So please, make that call.
Sotalol just doesn't play well with certain other things. This do not mix list is crucial. It includes other heart rhythm drugs, some specific antibiotics, and even other common heart medications. This is exactly why you have to tell your doctor about every single thing you take. Prescriptions, over-the-counter stuff, vitamins, supplements, you name it. And alcohol, it's really best to just avoid it, since it can make side effects like dizziness a whole lot worse.
Here's another really specific rule for you, especially if you ever take antacids. If it's one that contains aluminum or magnesium, you have to follow the 2-hour rule. It's simple. Take the antacid, then wait at least 2 full hours before you take your Sotalol. That 2-hour gap is what ensures the Sotalol gets absorbed properly so it can do its job. We've now arrived at our final section, and we've saved the absolute most important rule for last. We're calling it the compliance commandment. If you only remember one single thing from this entire guide,
Please make it this.
Let's just let that sink in. Never, ever stop taking Sotalol on your own. I don't care if you're feeling fantastic or you think you don't need it anymore. Stopping this medication suddenly can have very, very severe consequences.
So why is this rule so absolute? What's the big deal? What actually happens if you just stop taking it? Well, the answer comes down to something called the rebound effect.
Think about it like this. While you're taking Sotalol, your heart rhythm is being carefully managed, it's protected. But if you stop suddenly, your body can rebound, and it can rebound hard. This can cause a dramatic spike in your blood pressure, severe chest pain, or it could even trigger a heart attack. It is a risk you should never, ever take.
So to wrap everything up, let's just boil it down to your 4 most critical takeaways. Number 1, consistency is everything. Number 2, never double a missed dose. Number 3, know the emergency warning signs and act on them immediately. And number 4, the golden rule. Never, ever stop this medication without your doctor's guidance. You know, following these guidelines isn't just about taking a pill. It's really about being an informed, active partner in managing your own health. And now, armed with all this knowledge, you are fully equipped to use Sotalol safely and give it the best possible chance to work for you. You've got this.